Let's get started. Um, Welcome to the last results conference call of 2025. I can't believe I'm saying that. That's just the year's gone so fast. However, before I start, I want to apologise for the fact that the email we sent you last Thursday had the wrong date for this call on. It's so easy to get that wrong. Anyway, we had to send out a corrected version yesterday, and I'm really sorry to have to add to your email traffic, but hopefully that hasn't prevented too many people from being here. Um, so into the call. Yeah, I can't believe how fast this year has gone, and how much we've really worked on things together, including obviously working on some things that we really didn't expect to be coming our way at the start of the year. So as always, I'll do a little kind of round of the progress in our kind of collective efforts before we turn over to our guest speaker. Um, I'll do the usual. Oh, hang on, here is Sober, the person you were just talking about, Ricky. Um, so we have got somebody whose first time is on the call. Sober, hello, welcome to you. I'm Naveed.
Hello.
Um, Thank you for joining the call. We've just started. You haven't missed anything. So I was just about to say that if this is anyone's first time on a results conference call, then a big welcome to you. My name's Naveed Chowdhury, and I'm the head of campaigns at Results UK. So I'll just start off with a little bit of housekeeping. Please keep yourself muted as always during the call. If you've got any questions or comments, try and use the chat box. Captions are on if you want them. You can turn them on and off using your Zoom toolbar. And we are recording this call. So if you'd rather not be in the recording, then please feel free to turn off your video. Um, so before we introduce the main topic of the conference call, I'm going to start off with the usual updates on results advocacy. But mainly this month, I'd like that to be a kind of reflection on what we've achieved together in, as I said, what has been another very unpredictable year. We've had a few of those lately. So, back in February, of course, we had the news of the cut in the UK's official development assistance or ODA budget to 0.3% of our gross national income, which I think came as a bit of a shock to all of us, particularly given the previous statements of the Labour government. So we had to rapidly try to influence how the cuts would be made and what would be protected, what we hoped would be protected. I personally think we did a pretty good job, as good a job as we could have done of that, given that the minister, Baroness Chapman, was brought in with a mandate to make cuts. We weren't going to stop that happening. And of course, we then had that government reshuffle in September, and we started having to work with a new Foreign Secretary, Yvette Cooper, and get her up to speed with our issues. So I'm just keeping an eye on the waiting room. Pete's just joined us. Um, so in this month's action materials that we just emailed to you last Thursday, we're asking you to consider doing three things this month. First, to celebrate the achievements that we've had this year against this very turbulent backdrop. Um, Secondly, to kind of plan what your advocacy might look like in 2026. We'll talk about some of the things that are coming up, but given that we never know exactly what the new year will bring, we plan as best we can. And third, maybe consider explaining these issues to friends and family to get other people excited by what we can get do some advocacy on together in the next year. So for a minute or two now, I'd like to dwell just on the first of those, which is the celebration part. Now, that might seem a little bit of a weird thing to say, a little bit of a weird word, given all the things that happened last year and the cuts. Our government has accepted that it's got an obligation to spend 0.7% of our gross national income on ODA at some point in the future, although, of course, at the moment that feels very far away, particularly given the current state of politics. But gaining that commitment was an important result, especially at the moment with other parties actually talking about further cuts. So that's really important that we're at that point. In addition, you'll probably remember that back in June, we managed to get a commitment of £1.25 billion for the fight to vaccinate children around the world from preventable diseases. And then just last month, another £850 million for the fight against HIV, TB, and malaria. These investments made by the government would definitely not have been agreed without our pressure, without your pressure. So I just want to take this time to say huge thank you from me for all of your efforts. They will be felt by literally millions of people around the world in the coming years. Now, of course, we wanted to do more. Inevitably, we said so publicly that we would have liked to see those replenishments for the vaccine, Gavi, the Vaccine Alliance, and the Global Fund to be much larger than they were. But in the current constrained budgetary environment, they really are big wins. So those are the kind of the highlights that I've pulled out. But I don't know if anyone would like to say a bit about how they're feeling at the moment, about how their advocacy's gone this year. It could be one of the things I've mentioned, or it could be something else that you've done on advocacy for international development. So I'll just open the floor for anyone who wants to reflect on how they feel about the year, if you'd like to.
Naveed, I don't mind chipping something in.
Please
feel
do.
that what an awful lot of us have now got Labour MPs who were not MPs at all 18 months ago. And there was a long time, I remember at the end of last year, when a lot of us couldn't even get a meeting with our MP. So our MP is Arthur Scott, and he is one of the new Labour MPs that was a bit surprised to become an MP. And I think, I mean, this might be overstating it, but I do honestly think to some extent we've been an influence on what the people of our constituency want right at the beginning of his parliamentary career. And probably the highlight was that there was an advocacy day earlier this year. We met him in person in Parliament. And I think it's probably true of quite a few of us in results that actually we've got in at a really early stage in our MPs' parliamentary careers to kind of make the statement for the things that we stand for. So it's a bit of a hard thing to measure, but that's what I'm thinking, that we've actually influenced our MPs quite a lot. Those of us that have, brand new MPs, which is quite a lot of us.
It is, yeah. Thank you, Ricky. That's really brilliant to pull out that political angle. I must admit, I didn't mention. I think at the beginning of the year we were still feeling that sort of, if the election didn't feel that long previously, and we were still struggling, weren't we, to get to meet MPs. That's a brilliant reflection. Alex, I see you've got your hand up.
Yeah, I was actually going to make a very similar point. I had a meeting with my MP as part of one of the lobby days that we did this year. So there was a big sector-wide campaign against the cuts to ODA. And as part of that, I went to Parliament. I had a meeting with my MP. Like Ricky, who's a new MP. When he was first elected, actually, he had the smallest majority in the country, only 15 votes. He's now got the second smallest majority because there's been a by-election. There's one that's even lower. But it was a really interesting meeting in the sense that I felt very positive about having got the meeting because the previous MP I would never have got one with. So I felt positive about that. And it was a very constructive conversation. He didn't do what I wanted him to do. I wanted him to immediately take action and to talk to the government about restoring funding to ODA. And he explained to me why he wasn't going to do that. But it was a very, very constructive conversation. And it was the start of a relationship. And I think that's really, really important in advocacy. It's not just, obviously, it's lovely when whoever you're trying to influence does exactly what you want them to do when you want them to do it. But that doesn't happen very often. So just the fact that we had a very open, very frank conversation, and I feel that I can now go back to him and raise other issues, I think is really, really important.
Thanks, Alex. I was going to ask, does anyone else want to have a reflection about the year? Jill, you've got your hand up.
Yeah, I feel that's a major win. This time last year we were I was trying to make contact with him, but I've actually had 3 meetings with him this year, 2 official ones and one where I nobbled him on the high street, and so that's been great. And I feel I'm on their radar, and I've also made contact with their office, which is great, and they know who I am and I know who they are. So we're up and running. But he's a Liberal Democrat, so he hasn't, he's voting in the way that you'd want him to vote, but it's not having much effect. But anyway, there you go. Win some, you lose some. I think that's a major win this year.
It really is. Thanks, Jill, and thanks everybody who shared. Anyone else want to share a reflection of their advocacy this year? I can't see any hands. I will move on. So yeah, thank you for sharing those thoughts. I think it's been a mixed year, but given all of that, I think you should honestly feel able to pat yourselves on the back. It has been hard to get those meetings, but they have started to happen in many cases. Maybe share what you've done with your friends, if you don't already. We still need to keep telling the government very clearly where they need to do more. I think that's obvious on things like tackling malnutrition, on polio eradication, on access to education, especially girls' education, and on financing the sustainable development goals generally. One other thing I'd like to thank you, Alex. In the chat, Alex has put, Jill's done a brilliant job of getting letters published in newspapers. We're having a good flurry of media activity as well, and thanks to everybody who's done those. Thanks, Alex. Just in terms of progress on some of the politics, we had that sort of quite bad news earlier in the year about the cuts to USAID, which has had a huge impact on many international development programs around the world because just simply of the US being the biggest international donor. And some of you might have been on the call where our colleague from the US, Lisa Marshall, back on this in spring, spoke about that. Just in the last few days, we've been hearing some very encouraging messages from our colleagues in the US that the US government is quite likely to continue to support the Global Fund to fight HIV, TB, and malaria. And results, volunteers and staff over there are working really hard to gain strong bipartisan support. So fingers crossed we'll see some kind of financial commitment from the US as well, though that hasn't happened yet. And we have also yet to see some of the other big donors like France, the EU, Italy, and Germany make pledges to the Global Fund. Sadly, there are signs that they are all likely to reduce their commitments, just as the UK did. And of course, we'll be following this next year and keeping you in the loop on progress. So our CEO, Kitty, was at the Global Fund Replenishment Conference, which was in South Africa the week before last. And together with other NGO heads, she did quite a lot of media work to persuade countries to step up. We managed to persuade the Prime Minister to go to the event. It will come as no surprise that he didn't stay very long and was much more focused on the G20 discussions, particularly on Ukraine. I'm going to post a couple of links in the chat box. One to an article in The Guardian on what happened at the conference, so the global picture of the replenishment. This is on the Global Fund I'm talking about. And then another one on what happened specifically around the UK and its contribution and how that we again thought that should have been higher than it was, but in the circumstances, it was better than it might have been. So if you bear with me a second, I'm just going to put some links in the chat. Yeah, I think there's 2 links there. If you're interested, they're both links to The Guardian as it happens. One of them quotes results. The other one quotes, I think, one of some of our partners, but not us specifically. So nevertheless, despite the shortfall in funding with the Global Fund, we'll obviously need to manage or make up from other donors who've not yet pledged. A huge thank you once again for all your advocacy that you've done on the Global Fund this year to fight those 3 diseases, as well as for all of your other advocacy on education, vaccinations, malnutrition, and development financing. We haven't got everything we've wanted, of course, far from it. But without a shadow of doubt, you've helped the UK continue to feel it has to have a strong stake in global efforts to end poverty and disease. And this will have a big impact, as I said, on people and communities right around the world for long into the future. About this time, I would hand over to Will to do a roundup of what you've been up to around the country, but I'm afraid he's not feeling very well this evening. He's just messaged me and couldn't join the call, so I will carry on. Sorry, you're hearing a little bit more of me than usual. So firstly, I know that 2 or 3 people attended a talk last week organised by the Aid Alliance about some political analysis from the charity More in Common, which looked at how to communicate with people from different political and social backgrounds. Obviously, that's a big deal at the moment with very much the polarization of political dialogue in this country. If anyone who attended is here, do you want to say anything about it? You don't have to. I just wondered it might be interesting for other people to hear a little bit about that. Oh, Michelle, yes, go ahead.
Hi, Naveed. Hi, everyone. I'm a little bit put on the spot. I would have to go find my notes from the call. It was
Doesn't matter about the details.
Yeah. Look, it was really interesting. It was using some opinion polling and focus group research that More in Common had done, talking about the way people in the UK felt at the moment about various issues, including ODA. And one of the most interesting things to come out of it, which I think we've seen before, certainly other research I've seen and in other places, that there are ways to talk about these things with just about anybody. It's about what hook you use and what it is that you should emphasize with this group or that group to talk about, so even, rusted on conservatives, you can talk about how ODA is about ensuring British national security. So there's a whole lot more in the stuff they've got, but it was basically just segmenting the country into those particular groups and talking about the top line sort of ways we might talk to each of them. That's pretty much it. Thanks.
Thanks, Michelle. In case anyone's interested, and which sort of stuff that we grapple with all the time as results, and any tools like this or tips are always helpful. So I'm just putting in the chat that the model that they've got on their website, they've got 7 segments of the population, and it's not just left through to right as a spectrum, but there was also stuff around age, people who are more using comment on the internet, other people who are people who sort of entered their political thinking around the time of the lockdown, that kind of stuff. So it's definitely kind of an update on some of the stuff that we might have seen before, and I thought it was quite interesting, so just thought we'd share that with you. In terms of the actions that you've been taking lately, massive thank you to all of you who've been writing to Yvette Cooper or writing to your MPs to pass on messages to Yvette Cooper. So far, I know of about 20 letters. I'm sure there are more. So thank you for all those actions, and of course, the other actions I mentioned from earlier in the year. Next, I'd like to just quickly flag up an opportunity that we mentioned in our newsletter just a couple of weeks ago. This is on December the 15th. We have got a parliamentary event that colleagues are busy organising as we speak. Hopefully not as we speak, because they should have stopped working hours ago. This is the launch in Parliament of our Good News on Nutrition briefings. So our colleague Sunnit has been working on these throughout the year. There are now 3 of them, and we're going to launch them together as a set, and they provide recommendations for governments seeking to invest in nutrition programmes, to make their interventions as effective as possible. So you're all invited to that. There'll be a range of speakers, including Sunnit himself. It's an afternoon event in Portcullis House from 1:30 to 3:30 p.m. in the Attlee Suite. You'll need to give yourselves around 45 minutes or so to get through security, and also bring photo ID and a copy of the invitation. So if you'd like to come, get in touch and we'll send you an invitation. The person to email is not me. Although I can pass them on, that'll be no problem, but it's someone called Sungna Lakhani, and I'm just going to put her details in the chat box, and you can RSVP to her, and that's her email address there. So just say you want to come along. It's, as I said, it's the 15th of December, which I think is a Monday. Yes, it's a Monday. And thank you, Tony. If you would like to invite your MP as well, we're trying to get as many parliamentarians, civil servants, NGO allies as we can. We've got quite a big room, lots of space, which we often don't. So please do feel free to sign up for that and invite your MP if you'd like to. Next, a big thank you to those of you who came along to our new meeting venue for the London group on the 20th of November. A small meeting, but a good one. We had a great discussion on the value of local campaigning, and our next meeting in London, the London group, will be in the new year. So anyone in London, please do join us. We'll be putting that meeting up on Meetup, the website Meetup, which is the software platform that we're now using to promote group meetings. And any group can use that if they want, but at the moment, we've just got London set up on that. Right, before we get into the topic of this conversation, I'm just aware of time, but I would like to just remind you, which we have done once already, but easily forgotten, that the January call, this conference call, will not be on the usual first Tuesday, which would be the 6th of January, which we couldn't really prepare for because it's only just after coming back after the break. So we've moved it back a week to Tuesday, the 13th of January at the normal time of 8 p.m. So next conference call, Tuesday, the 13th of January at 8 p.m. Right, so finally to the topic of this evening's discussion. So last month, if you were on the conference call, you'll have heard about the current state of play with two things that we advocate on at Results, namely the right to an education and the right to adequate nutrition, and how they're particularly important for women and girls living in poverty. So these are things that everyone everywhere has a right to. And this month, we're going to follow up with a third issue area, which is health generally, which we believe is also a human right, and the denial of which is both a cause and a symptom of poverty. Now, we're going to focus on this partly because we expect to be doing a lot of advocacy on health in 2026, because some of the opportunities that are coming up on the world stage, you're shortly going to hear from Alex about those. Of course, we'll also be focusing on other things like education as well, as I think we mentioned last month. And the recording of last month's call is on our website on the events section, if you want to catch up on that. So, of course, health is a very broad topic, and we're only experts in advocating on some of them. And we also don't get involved in clinical issues as we're not medical experts. But we do advocate to ensure that lower income countries have access to the resources and the expertise they need to build their health systems, and to make sure that the UK is playing its proper role in supporting them to do this. So, to take us through this and provide a bit of a recap on some of the health issues that Results works on, I'm going to introduce Alex, who's already spoken. So Alex is Results' head of policy advocacy. Many of you know her already, and she leads our policy team, which provides expert analysis and advice on a whole range of issues that Results works on. So Alex, welcome. Thank you for being our guest speaker. I wonder if you could start by just introducing yourself briefly for anyone on the call who hasn't met you so far.
Yeah. Hi, everyone. As Naveed said, I'm Alex Runswick. I'm head of policy advocacy. I've been at Results for 3 years now, which is quite exciting for me. And as Naveed said, I lead our policy advocacy team. So we support our parliamentary advocacy colleagues with the policy reports and the evidence that they need to make the case to decision makers about the changes that we want to see in the world. And we also get to influence processes at the United Nations and globally around health issues. So basically, if it's an MP, then it's Lucy's team. And if it's a civil servant or a kind of global process, then it's me and my team.
Thank you, Alex. And of course, that same information is what we use to provide the briefings that we produce for you guys as well. I'm going to ask Alex to speak for a few minutes about this topic, about the health advocacy topics that we're going to continue to work on, how official development assistance, how our overseas aid supports health in different ways or could do better, how donor countries are expecting their future support for health to look different, and then a little bit about the things that we need to do in 2026. Because it's about our kind of priorities as Results, it felt not quite appropriate to do the usual planting of pre-arranged questions among the audience. So I've asked Alex if she could, this is a sort of quick sneak peek behind the scenes, isn't it? If she could hold forth on those topics. So what I'm going to do is just put them in the chat box so you can remind yourselves of what are the kind of the main breakdown of the things that Alex is going to speak to. And she's going to speak to somewhere between 10 and 15 minutes worth of material, I think. But there in the chat box, you should have 1, 2, 3. That's 3 bullets. That's not 4. I missed something. Hang about. Bear with me. Yes, you can see where the 4th bullet's gone. And there we are, the 4th one, as I said, the health advocacy we're expecting to do in 2026. So, Alex, over to you.
One quick kind of operational note is just to say I'm partially sighted, so I won't be able to follow on what's going on in the chat and focus on what I'm saying. But if you do have any questions while I'm speaking, please do just ask. I'm very happy to talk about anything in more detail or to go in a different direction if that would be helpful.
So I will pick up anything that is in the chat that you need to answer there and then. But of course, in the usual way, we'll take questions after from the floor after Alex has spoken. So yeah, thanks, Alex.
So obviously, as you know, results exist to end poverty, and we think that the 3 things that you need to be able to get out of poverty are health, education, and economic opportunity. Health is one of the main areas that we work on. I know we covered some of our education work on our call last month. But obviously health, as Naveed's mentioned, is a huge area. There are so many different things that we could work on. And because what we do is called cross-cutting advocacy. So we don't just work on one issue. Like some organizations will work on one specific disease. We don't. So we are often making links between different health issues, even some issues that we don't necessarily work directly on. We will be making those links and making sure that decision makers understand how all of this is connected, because it is, particularly when you're talking about ending poverty. But to give you a very quick overview of some of the issues we work on, we work on routine vaccinations for children. So that's the work that we do with Gavi, the Vaccine Alliance. And specifically, that's about making sure that people are protected from preventable diseases. So obviously for diseases where we have a successful vaccine, if a young child is given the vaccine, they are very unlikely and almost won't die from that disease if they do happen to be exposed to it. And there are enormous numbers of diseases that once would have killed enormous numbers of children that aren't, precisely because we have those vaccines and we have organizations like Gavi that are able to access the vaccines, access treatments, access diagnostics, and get them to the countries and the communities that need them. So vaccinating children is one area of things that we do. We also work on infectious diseases. Tuberculosis is the main one. TB, as I'm sure all of you know, is one of the sorry, let me see if I can complete a sentence. TB is the world's biggest killer in terms of infectious diseases. It's also one of the oldest diseases. It's been around for hundreds of years. It's the history of tuberculosis is actually genuinely very fascinating because it's all to do with the history of science and the development of our understanding of germs and bacteria and how to treat disease. So it's, on a geeky level, it's genuinely fascinating. But it's also one of the main diseases of poverty, and that's obviously why we're engaged with it. So that's our work with the Global Fund that Naveed's already been talking about their replenishment, but it's also one of the things that I'm most proud of in terms of our TB work is the work that we do with TB survivors and the community groups who are working on the ground to make sure that people get access to the treatment that they need and to change the way that healthcare is delivered, because healthcare and the medical profession have not historically been very good to people with TB. And obviously that's something that needs to change. Another issue that I just wanted to flag up is obviously pandemic preparedness. We've all just been through the COVID-19 pandemic, so we're all more aware of the fact that there can be global health pandemics, that's a threat that we live with, but also that pandemics make the case for all global health issues of the fact that diseases don't respect borders. So it's only by investing in systems now, whether that's making sure that all countries have strong health systems that can deliver vaccines, that can reach people with treatments, whether that's doing surveillance for diseases and making sure that we're aware of when new diseases emerge, whether that's making sure that all communities have access to healthcare, whether that's identifying how diseases are transmitted and dealing with outbreaks as they happen. So pandemic preparedness is also an important part of what we do because it links. I was saying earlier that all of our advocacy is cross-cutting, and all of these things linked together. They might sound like they're all very bitty, separate things, but actually, if you're talking about tuberculosis, you can make a case for how investing in TB care is actually also a form of pandemic preparedness. Because if you have community-based workers who are going house to house or who are working in with hard-to-reach communities and testing for TB, they can also be testing for other diseases. They can be testing for diabetes. They can be testing for any other disease that there might be an outbreak of. And they can identify things because they're based in their communities. They will see the diseases as they emerge, and it's what we call surveillance, and they can then report that back into the healthcare system, which reports it back into the global healthcare system, places like the WHO, and that will make people aware that there is this new disease emerging. So although all of these things might sound like there's just a bitty thing here and a bitty thing there, and it's all very complicated, they actually all really link up, and that's a really important part of the advocacy case that we make. Obviously, although ODA is often presented as being, and international development is often presented as being something that is just about other countries, sometimes people present it as charity. It's not. It's morally the right thing to do. I would absolutely argue that, and I do argue that. But it's not just about charity. It's about partnership. It's about solidarity, and it's also bluntly about our own national self-interest. As I've already said, diseases don't respect borders. We've had environmental samples of polio in the UK last year. We've recently had a case of wild polio in Germany. We have increasing numbers of TB cases in the UK. So these health issues, yes, it's right that we save lives wherever in the world lives need saving, but it's also about making sure that we as a community are protected too. And it's also, when you're making arguments to MPs, you often talk to them about things like global health security, which is about us being safe because everybody else is safe. But it's also about like the British science and research and development industries, and the fact that our universities, our research institutions all benefit from investments in ODA and investments in research and development. So there is absolutely a very strong moral case. There is also the slightly more self-interested economic case as well that we can also make. We've done a lot of advocacy together this year on what we call replenishment campaigns, which are basically raising money for multilateral organisations to help deliver healthcare in the places that need it. But one of the things that people have been saying is like, this is the last time we're going to do it like this. We can't keep doing it in the same way. So increasingly countries are wanting different things from their support for international development. So we all know that the amount of money that's being spent on ODA is shrinking. Recently, Canada announced that it is cutting back on the amount of ODA it spends. France has yet to make a commitment to the Global Fund. So there are lots of countries, not just the UK, where spending on international development is going down. And while this is obviously a really disappointing and distressing trend that we're campaigning against, even when we reverse the trend, we're going to need to think about how we do things differently. So even when we increase the amount of money that we have to spend, we'll want to think about how can we do partnership differently? How can we work with national governments more effectively? So it's not just international bodies telling governments in countries that have a high burden of TB or where there are polio outbreaks, this is what you must do. But it's about working with those governments so that they can raise some of increasing amounts of their own budgets to spend on health, so that they can decide what their own national health priorities are, just in the same way that we do, so that you can create new partnerships between national governments and civil society organisations in those countries. And it's not just about strengthening the international community, it's about strengthening CSOs in country as well. So one of the big things that's being discussed in our sector at the moment is how we can do aid differently. And I think there are lots of exciting ways that we can do that. And obviously, we're talking to lots of our partner organisations in the Action Global Health Partnership, with civil society organisations that we work with through our work on Gavi, on the Global Fund, TB survivor groups. We're working with lots of these groups to think about how that can be done in a way that's really meaningful and that makes sure that communities are empowered and are able to come up with solutions for their own healthcare issues. So, and actually, I'm aware I'm talking a lot, but I just wanted to quickly talk about the kinds of things that we might be doing on advocacy next year. This is basically what we are all doing in our individual teams at the moment. We all have to do annual work plans. We all have to start thinking about what are the big global moments that might be happening next year that we want to do advocacy on. So, for example, you may remember that we've worked on something called high-level meetings at the United Nations in the past. There was one on tuberculosis, there was that we were very active on. There was one on antimicrobial resistance, which is when diseases become resistant to the treatments that we have. And we were active on that one as well, particularly because of our work on tuberculosis. There's one this year coming up on pandemic preparedness, so that might be something where we want to influence the UK government. There will be more calls for funding. For example, there's this organisation called CEPI, which is all about preparing for pandemics and specifically for doing the research and development. So they have something called the 100-day mission, and that's about getting from a point where it is identified that there is a disease that is a pandemic threat. So that's when the WHO, the World Health Organization, will say, okay, we have detected a certain number of cases of this new disease. It now has the potential to become a pandemic. And they will then try to get from that stage to having a vaccine and or treatment within 100 days. And that's obviously a very small period of time, but that's the kind of game-changing science that will revolutionize people's experience of health and obviously save huge amounts of life. There is also something called the GFF. We have far too many acronyms. I do apologise. I can't keep up with them, so I don't know why you should have to. But this is basically an initiative that means that when governments invest their own money in nutrition work in particular, but in maternal, newborn and child health and around nutrition, that they are able to access other funds held by the World Bank. So the more that countries invest their own money, the more money they are able to get from funds held by the World Bank. But obviously that only works if governments like the UK are giving this initiative, the GFF, the money that they can then access. So those are just some of the things that we might want to be working on next year. There will be others. There will be things that we can't predict right now. There will be, there will be things that the government does that we will want to respond to. There will be there are always events that happen that we can't predict, but those are some of the themes that we know are going to be coming up. And it'll also be things like thinking about how we can work better in partnership, how we can all do our advocacy better, what creative things do we want to do differently. But anyway, so that was a very top line overview of some of the things that are coming up in the next year so that we can then start to have a conversation about what your advocacy might look like.
Amazing. Thank you, Alex. So that was I feel that was almost like a bit unfair for me to ask Alex to cover all of our kind of global health concerns in barely 10 minutes flat, which is amazing. I know that some of you will have heard of a lot of that already, and it won't have been news to you. There will be others on the call who maybe some of that you hadn't come across before. And also, we don't always talk about it in the round as why we're doing all these different things. You see bits of it every month, and it's not so easy to see the why of all of it. So that's why we wanted to do this and pick up on this theme and how it will come in and out of our advocacy plans month by month next year. Thank you, Michelle, for putting a couple of links in the chat, some links to a podcast and a book. And yes, GFF, it stands for Global Financing Facility. It's a global financing facility for women, children's and adolescents' health, I think is its subtitle or full title, something like that. But yes, slightly complicated funding body that actually manages to leverage quite a lot of resources for global health work, as Alex mentioned. So obviously, as this year shown, and pretty much every year shows, we can't exactly predict what's going to be the political backdrop to all of our advocacy. So that will, of course, affect our plans. But there are some things we know. And in addition to what Alex said, I've just put in the chat a calendar of dates relating to international development advocacy in 2026. So that's things like some of the UN international days, one or two replenishments that we're aware about, not just health, but also education. There's going to be loads of dates missing from it. I noticed we didn't have the UN, which is when some things are happening. But that's all in September. So, there's a few other dates which you can think about as well. So feel free to go in and download that. You can just print it off if you'd like. So as promised, we are going to open up the floor to questions for Alex about really any of those health issues. She's really putting herself out there, pretty prepared to answer absolutely anything. She hasn't been able to prepare for what those are. So please feel free to ask her questions, but also I'm hoping, because this is about planning, that maybe if you come up with some ideas, you might want to share this with others on the call. So thinking about what you've heard or thinking about what you're interested in on international development and health, what things might be opportunities that might work where you are that other people could also do. So I'm hoping it'll be a bit more of a kind of a general discussion, but I'm going to open to the floor. Obviously, as always, just unmute yourself or post something in the chat. And if you want to, as always, it's traditional for me to provide my mobile number, which I've just done. I don't know how many people find that useful these days, but I do it. And so three ways in getting your question, and I will ask it if it goes into the chat for those people who can't see it. So I'm going to open the floor. Jill, I see you've got your hand up.
Hi there. This afternoon I did a presentation for a local primary school, the staff of a local primary school, and I covered things like the global goals and the GPE and the education thing up, and also a bit on debt and nutrition, and they're really very keen to do things. And they said, is there other things around for primary school children to do? And it set me thinking. I know there's send my friend to school, but that's a one-off thing in the year. And I'm just wondering if anybody is developing stuff, or whether we could adapt materials. For there were a couple of teachers that were quite keen to write to the MP, for instance. Which is good.
Thank you, Jill. Alex, did you want to come in on that one, or?
I was just going to say, I'm not aware of anything specifically for primary schools, but I'm sure there is something. So if you leave it with us, we can find out.
Yeah, I'm just floating it because I think it's quite a good contact.
Well, you might want to look up the what they call
the global goals.
The global goals people do produce materials for schools across a range of issues. So I'm just trying to remember their name, but the global goals website, it's got all sorts of graphics, but I'm
It's
pretty
called the
sure
world's largest lesson, isn't it?
world's largest lesson. That's the one. Yeah,
Yes. I hadn't
that
thought of that.
that might have stuff in there.
Yeah, thank you. Yes, I hadn't thought of that.
And thank you for putting in the chat that there's a the UN website's got a very good source of international days and weeks as well. So
Yeah.
the
I
link's there in
I
the
always
chat.
go to that one if I want to write an article and think, well, what's around at the moment? You know, I can as a hook, which is really helpful.
Absolutely. Question from Pete. Do you want to ask it, or shall I ask it for you? You're on mute, Pete.
I'm
Oh,
unmuted.
there you go. Hello.
Hello. No, I mean that's the question. Is we're battling against an increasing shortage of funds every year, and does results actually look at the other end of that equation? Why are we running out of money? Where's it going?
Well, we would argue that it's not that we're running out of money, it's that political choices are being made that are against international development. And so our job is to make the political case for why the government should be investing in international development. Essentially, they could if they wanted to.
And how do we know that?
Because there's always money if you need it. Because sorry, that was a flippant response, which is not very
That's
helpful.
okay. You're forgiven.
How do we know that? Because there is money for other priorities that the government does have. So, for example, when we were doing the advocacy day at the beginning of the year about the aid cuts, we were able to identify other sources of funding that the government could have used that would restore ODA or not have the cuts to ODA. So there is money there if they choose to spend it on development, but at the moment they're choosing to spend it on other things. And we have to make a really big case for why that's not acceptable. And it's not going to be easy, but it's absolutely something that we can do, and the sector as a whole will be doing.
Can I bring it? Oh, sorry, go ahead, Pete.
Yeah, it's just if it's the case that there is materials and documents and arguments available to say not only that we need to maintain our level of overseas aid, when we have those arguments and we present them over and over and over again, but there's other argument that there is money available, and does being able to identify that in our advocacy with the government, with our MPs, are we able to make that argument? Can we actually say, well, you've got money over there, look, why don't we spend it?
Can I come in at that point, Pete? Because I think there's another comment in the chat about those choices. I think Michelle's put in about military spending, and obviously at the beginning of this year, they were very, very explicit that they wanted to fund defence, and international development was one of the things that's going to suffer. So as well as identifying where the money is and actually doing the accounting, essentially it's a political choice. As Alex was saying, that was one very clear example where they knew where the money was and they chose to reallocate it. And I'm sure there are others. Obviously, we've just watched the budget and listen to the kind of choices that they're making and the kind of pressures that the government is under in terms of domestic spending before you even go to international spending. So I think it's yes, we can say you could take the money out of this budget, as for example we do when we ask them to give back the money to the Foreign Office that they're taking to fund the Home Office's programme of housing refugees in their first year. They should be funding that from a separate Home Office budget. But we can do so much, and I think hopefully what you've said is a prompt for us to think about possibilities of where money comes from. But at the end of the day, we are in the kind of political rough and tumble, if you like, that we see every day on the TV screens.
What I would just very quickly add is that
yeah.
The issue is not so much the technical, although you're right, I completely understand why you're asking that question. The bigger issue is not identifying the pot of money. It's convincing the government that people, and by people I mean you, I mean constituents, I mean the great British public, want money to be spent on international development. And when we can do that, that will help leverage the ability to find which budget line it should come from. The problem we have at the moment is that the government believes that the public aren't interested in international development. They're wrong, but we have to demonstrate that they're wrong.
They're telling us that, and frankly, I think it's a bit of an excuse. But with all these new Labour MPs, we do have the opportunity to switch the dial a little bit on that.
Are you saying that we're actually advocating that the UK incorporated spends less money on defence and more money on overseas aid?
It's not our policy position, I believe. I mean, many of us do believe that, I would think, but some of us on this call might believe that actually at the moment, a current moment in time, we need to be spending on both, and therefore there's another priority which should be deprioritized, if you see what I mean. So we can't. I think for results as an international development organization, Alex, correct me if I'm wrong here, because I'm straying into your turf. But we'll make some broad points, but we haven't got the capacity or the expertise to delve into budgets of other departments like social services or health or culture or whatever it might be, and do individual findings of pots of money for international development. To some extent, that's the government's own business. Alex, would you like to come in on that before we move on?
No, I think you've covered it.
Okay, thank you. Another thing that's Jill's and Deirdre have brought up in the chat is about global issues. So in Jill's case, I'm trying to conflate questions, but I don't think this is going to work. So Jill's raised the issues of global debt and wanting to carry on working on that. So that's something I hope we'll be able to come back to as well. But I don't think we've quite got a roadmap for next year.
Yes, we do.
We do? Okay, I'm wrong.
We've got Sunit's next report on illicit financial flows and nutrition, and there is going to be or at least allegedly, there is going to be a UK hosted conference on illicit financial flows, I think in kind of spring of next year. We don't have very many details on that yet, obviously, but as soon as we do, we will be sharing it. But that debt is one of the government's stated priorities, so obviously we will be doing more on that.
Brilliant. Thank you, Alex. And then Deirdre has raised, again, the global concern that it's not just UK cutting back on ODA, but other countries such as Canada. So kind of what's going on globally. Is there something we can say about that?
One of the really challenging things is that once one country cuts aid, it then encourages all of the others to do that. And obviously with Donald Trump and the US kind of completely scrapping their US aid program, that has sent such shock waves through the system that it has, and also the level of conflict that is going on in the world has made governments very, very scared. So it's a really difficult time, but it's not going to be forever. There have been cuts to ODA before, and we've got it back up again. So I'm confident that, campaign is working in each country, and it may be that we try and do something global. We haven't kind of got that far yet, but I'm confident that in time we will be able to increase the level of ODA spending again. But unfortunately, we're in a period where governments are each following each other and saying, well, if you're cutting ODA, I can get away with cutting ODA. And so they've all created this environment where it's now seen as acceptable to cut ODA, and that's what we have to change. I've spoken to colleagues working in different results organizations and in different civil society organizations in lots of different parts of the world. Everybody is working on this. This is not something that everybody is just saying, okay, we accept it, game over. So do expect to hear more about it in the future.
So the underlying argument is that the global conflicts and other financial pressures mean that it's okay to let the developing world founder in its own stuff.
Yeah.
So I remember in previous iterations of results, we actually did do campaigns based on explaining to people, because what I heard just now was that there's a public perception that aid isn't a priority, and so working on the public perception of the necessity for aid means educating the public on the reality of what we as the West are doing to the developing world. And we don't do enough of that, I think. Enough of that real, scary stuff about exploitation, about trade tariffs, about international banking, that whole gamut of what we're doing to the developing world. The public are not really aware of that. I have to keep making that argument, and it's just not a common argument. I'm not hearing it. I know people are willing to follow it if it's fully expressed, if it's strongly expressed. What we're doing to the developing world, they don't deserve what we're doing to it. So that would, for me, be a useful target for our campaigning.
I couldn't agree more, Pete. I think we need to make that case both for the political classes and to the public, because it's the public who influence the political classes.
Exactly.
So yeah, I couldn't agree more. You've segued very nicely actually into a question or a point that Michelle makes in terms of arguing for the sorts of things that we talk about, which is the argument about seeing ODA spending as a global public good. Michelle, did you want to say what you mean by that? Because it's a phrase that I've heard people use in different contexts. Oh, you're muted.
Sorry, thought I'd unmuted. I'm not an expert in this either. I quite like the framing. It's the idea, perhaps best encapsulated by some of the things Alex was talking about around, say, pandemic preparedness. The idea that if you have, say, a pandemic architecture, that is of no, that's not owned by any one country, and it's not only of use to any one country, it's for all countries, and so that's why all countries put into it. And a similar sort of thing, which has been an argument around aid before. Hey, if we help other countries rise out of poverty, then that's a good thing to do, but then they become customers for our goods. All of these things are, it's about getting away from the charity framing and saying, actually, this really would be of benefit to everyone. That's
Thank you. I think we've ended up in a place where we've got kind of two arguments there, and I think maybe both are important. And it reminds me of the more in common research that we talked about at the beginning of this call, because there are going to be some people who just need to hear, or you may feel it's appropriate to hear, what's going on in the world and what are rich countries for failing to do, and what are they actively doing to keep people around the world in poverty. And on the other hand, what are the positive things that we can do by working together, as we do with some of the existing multilateral organizations? So I don't think it's an either or. Both of those arguments can be deployed in the right way and in the right place. And I think as results, we need to be always thinking about that and helping you, I suppose, with our materials to be able to deploy whatever arguments you choose to deploy. So do keep us thinking about those things. I've been writing a couple of notes from this discussion as we've gone on, but we are at 9 o'clock now. So I'm going to hold us there, I think.
Naveed?
Yes.
I just want to say, Frank Zappa once said, "We are killing our customers."
Oh, I'm so glad we've ended on the Frank Zappa quote. That has just made my night. Thank you so much. I've just put in the link, which you were emailed already, but the December action with sort of a summary of what Alex has just said on global health. Very brief, I'm afraid, but it's just got some arguments about each of those kinds of things that we're going to be working on. We're suggesting you may want to have a read of those paragraphs on our web page. that I've just linked to say, how would you explain that to somebody? And the discussion we just had could be really relevant to how you choose to do that. And we're also asking if you can plan what you would like to do as groups or as individuals, or even bringing in groups of friends. So for example, do you have someone who's a friend who's in a neighbouring constituency who might be prepared to write to their MP, for example? So some of those explanations that you've heard from Alex that we put in the materials, they might be useful for you. So we don't have a direct advocacy ask this month. As often we've gone, we will hold that over for the break and come back in January with the next sort of advocacy activity. So we need to finish the call. Thank you as always for all your advocacy efforts throughout the year. I hope you have a great Christmas and New Year break. And I look forward to seeing you again on the 13th of January for our first grassroots call of 2026. I'm sure you'll join me in thanking Alex for her swift tour de force around global health advocacy. I hope you found that useful. And as always, if you've got any follow-up questions, drop me an email, because I can make sure that that question gets through to whoever is able to answer it. So I'm going to keep the call open just for a few minutes after the formal end of the meeting for anyone who wants to stay and chat. But if you need to go now, enjoy the rest of your evenings, and thank you for everything.